Right, hello, my name's Sara Humphrey and I'm the clinical lead for older people for the CCG. I've been asked to just give you a 5-minute quick bullet points about why you might want to have your flu jab this year. I often get asked questions about the flu jab, so what I thought was I'd put some of those questions together and tell you some of those answers. So first of all, what is flu? Flu's a viral illness, which means antibiotics don't help it, and for most people it just gives you a bit of a temperature, a dry cough, makes you feel really tired, but you get over it and you're back to work within sort of 10 to 14 days. For some people who are at high risk, actually flu can cause quite serious illness. You're more likely to get pneumonia, and for some older people that can mean getting into hospital and having quite a serious problem. Because of that, what we advise is that people have their flu jab every year. So, who needs to have their flu jab? Well, everybody over 65 at first, everybody who's pregnant, young people, young children, and people who are in what we call high risk groups, people with diabetes, COPD, asthma, heart disease. What we do in the practice is we check our records and we put a flag on it so that actually if you see a doctor, they'll remind you that you need a flu, and we also send out letters. Sometimes perhaps even send out a text alert as well. So, why do you need to have a flu jab every year? The problem is that flu is a virus and it's changing all the time, which means that the scientists look to see how many of the different viruses are around at a certain time of year and they make the vaccine. By the following year, the virus has completely changed and they need to make a new one. So that means even if you've had it in the past, you won't be covered again. So you have to have it again, unfortunately. And that's the same going forward. Who's eligible for it for free? Well, all those at-risk groups. So older people, over 65, those people in the at-risk group, the people who are pregnant, and the young children. Everybody else, unfortunately, has to buy it, unless you're a carer, in which case you'll be able to get it for free as well. Flu's not all about the flu jab, okay? So there are other things that you can do. Things like washing your hands regularly, especially if you've been near somebody who's ill, and avoiding going to work and being around people if you have flu. Is it safe in pregnancy? Well, the answer is yes. And actually it's really important in pregnancy. When you're pregnant, obviously you are less able to protect yourself from illnesses and actually can be seriously unwell if you get flu. And also, your baby can't have a flu jab until it's over 6 months old. So actually you having it in pregnancy protects your newborn baby. So yes, have your flu jab if you can while you're pregnant. What else? Okay, where can you get it? You can actually get it from your pharmacist, but you can also get it from your GP. Who shouldn't have it? Well, there are some people who actually shouldn't have it, and these are people usually who've got an allergy to a vaccine, what we call anaphylaxis, or if you've got an egg allergy. What else? Okay, I think I've probably covered most things. Do remember it's free. Oh, and the final one. People are always asking me if they can get flu from the flu jab, and the answer is no, you can't. It's actually not a live virus in the ones that you're having as an adult. So actually what you get is you might feel a bit off colour for a day, but if you did get flu, it's probably because you already had it or are unwell before you had it. If you are unwell and you're due for your flu jab with your GP today, if you've got a really bad illness, then don't have it, put it off for a few days. You can still have it if you're on antibiotics, but we'd rather you didn't have it if you had a really bad viral infection. If you want any more information, what you'll find is Staying Well This Winter leaflets in your GP and in your pharmacy, and you can always ask any of your healthcare professionals. Everybody's well up onto what we should be doing with flu jabs this year.